This is Dr. Sandra Laura Cremers, and I want to talk to you today about some issues after cataract surgery, which continues to be the most commonly performed surgery in the country. Some of our patients will choose some of the innovative implants, which are very exciting. Before, we only had the monofocal implant, which gives you one distance. So pretty much 99 to 100% of patients will need glasses either for distance, intermediate, and or reading, most of the time for reading. So the new lenses, which I've talked about in a previous video, the most commonly first one created was the multifocal. So it has little rings around the inside of the implant, which will give you the ability to see for distance, intermediate, and reading in the majority of patients. More than 90% of patients will not need glasses after a multifocal is put in. The downside is that there is always a compromise, no matter what implant you choose. This is one category of the new implants. The second category is called a crystal lens, which have these little haptics here, they're called these little arms, that have a beautiful center optic, so there's no rings, so the glare that happens after the cataract surgery is less with this implant than with a multifocal. The problem is that this implant called the crystal lens or True Line corrects for astigmatism. This one doesn't work as well for reading. The multifocal works very good for reading, but it can cause more glare if you're a nighttime driver. So if we have a nighttime driver, we tend to focus more on choosing a crystal lens than a multifocal. If you're going to be reading a lot, we recommend a multifocal instead of the crystal lens. But every implant has its positives and negatives. So the most important thing that you need to realize is that there's a compromise. We can't create the perfect lens that you had when you were 10 years old. We can, however, make you more comfortable in terms of trying to help your vision for distance, intermediate, and reading. And so here's some tips I want to pass on to you after you're going to have the cataract surgery, no matter what implant you have. The first thing is always to keep your lid hygiene and your tear film as perfect as possible. That's important, and I've talked about that in my previous videos and on my blog, iDoc2020 at blogspot.com, how to do the cleaning and get your tear film working well, because the tear film is just like a pair of glasses. And if your tear film is not working well, it's as if somebody's removing a pair of glasses from your good quality vision potential. The second thing is to always have a good light whenever you're reading. So if you're reading your newspaper or your journal, it's important to always have some light. So the light is important, especially after cataract surgery, because it will constrict your pupil. And when you constrict the pupil, the light will make the pupil constrict. That small pupil works to give you better quality of vision. So direct light is better, the higher luminance is better to help you see the material and improve the quality of your reading vision with both the multifocal and the crystal lens. So keep that in mind, but also with the monofocal. The computer, whenever you've had cataract surgery, should be tilted back just a little bit to help with the glare. Different people will need that more than others, just like different people will need more light than others. Some people don't even need light to see with their new implant. Also, to get an idea of where will you need to hold the material. Some people were used to holding it here, and then after cataract surgery they have to hold it here, but kind of experiment a little bit with moving your material and also how close to the eye it needs to be. The brain takes time to adapt no matter what implant you have, especially if we've changed the astigmatism in your eye, or we've given you something called monovision, which means we aim one eye, your dominant eye, usually for distance, and your non-dominant eye for near. And there's different degrees of that depending on how much a person's brain will tolerate. So different brains work differently. If you are very young, your brain is more likely to adapt or neuroadapt to the new changes than if you're older. So just keep that in mind. And there'll be images sometimes in terms of glare that most patients will actually improve. That symptom of glare when they're driving at nighttime will improve in most patients. Rarely, and in my experience, less than 0.5% of patients are so unhappy with the glare with the multifocal, this one here, that they would actually want to have it removed. That's very rare because we try to screen patients ahead of time. But if you're one of those patients that had a multifocal put in elsewhere and you're unhappy with the glare, we remove it and put in a different implant. The last thing is monovision. If you have monovision and it is your right eye that we are correcting for reading, that means your right eye is not great for distance. So when you're driving and you see the signs on your right hand side, we're talking about my right eye here and my right field when I'm driving, you would have to turn your head to see the signs in the distance with your left eye. So keep that in mind. Sometimes you have to turn your head for the left eye, which is corrected for distance, to be able to see the distance. And then when you're reading, it would be your non-dominant eye or your reading eye, if it's my right eye, that would be working for reading. So keep those in mind. Anytime anyone has any eye surgery, there can be a time of imbalance. So be very careful not to fall. Hold on to furniture or your friend so you don't go when you're going down steps. If there's that time between the two eyes being done, again, there can be that little bit of discomfort in terms of your brain adjusting. So this is all very common and normal. And if you have any questions, feel free to call and let me know. Thank you.